Bismillahirrahmanirrahim. Today we will talk about a test that is known as the FAIR test. And this test, we used it to check the Piriformis Syndrome. If a patient comes to your clinic and he presents with the clinical record of, or say there is no clinical record and he directly comes to you and he presents the glute pain and hip joint pain. So the test we performed here is the FAIR test. F stands for the flexion, A stands for adduction, I stands for internal, and R stands for rotation. So IR is the internal rotation. When we indicate this test, when patient feel the glute pain or hip joint pain, and it is specified for the Piriformis Syndrome. So what's the reason behind the Piriformis Syndrome, or what's the pathology that we say that this patient has Piriformis Syndrome? So we already told you that there is a plexus which is present at the lumbar region. The nerve root level is from L4, and that is the origination of the sciatic nerve. The sciatic nerve comes and moves all the way and crosses the greater sciatic notch, move all the way medially, and then it comes in the groin area, and then it comes into the thigh region, posterior to the thigh, and the popliteal fossa. It divides into two, the communicating tibial nerve and then pseudo communicating branches, and then to the one branch to the heel, one to the sole of the foot and to the dorsum of the foot, where it provides sensation only. When this nerve is impinged, where it is impinged, the area, if it is impinged in the disc area or the neural foramen, so it can also compress this nerve. So it can be radiculopathy as well. And it is compressed under a certain type of muscle, the hip muscle, which is triangular in shape, and we say that this muscle is known as the piriformis muscle. This nerve basically moves beneath the piriformis muscle, and it can be compressed by continuous pressure, due to which this muscle becomes tight and it gives the indirect pressure to the, or put pressure on the nerve fiber, and the patient becomes pain. But it not suddenly arises. When the position of the patient is like this, if he is continuously sitting and putting pressure over a period of time, the patient complains with hip pain. So the reason behind this is basically the compression of the sciatic nerve beneath the piriformis muscle. यानी उस piriformis muscle के नीचे से गुजरा है तो उसको कंप्रेस करता है. जिस तरह के मैंने टेलर्स की एग्जांपल दी, वो कंटिन्यूसली आवर्स हुई, यानी